The first technology that we're going to show you is called Cerec. Cerec is a computer-aided design and computer-aided milling system that helps us to create your crowns in one day so that you don't have to wear a temporary and come back. A lot of times we find that temporary materials, because they're weak, they're made out of plastic, they have temporary cement, that they break, they fall off, you have to watch out for sticky foods. And so we feel that this technology is a great service to our patients. I'm going to take you through a case and let you see how it would be for you. This is a demonstration model that we have that shows some teeth that have been prepared for crowns and inlays and onlays, things that we use to repair teeth. So what we're going to do is we're going to tell the computer that we're going to do a crown on tooth number 30, which is the lower right molar. There's a lot of different ways we can do it. We're going to tell it which material we're going to make the crown out of. Now the OmniCam is a very special technology that was developed in around 2011, and the OmniCam is an optical scanner. And the optical scanner allows us to take pictures very rapidly and in such a way that the computer is able to calibrate and measure the teeth to within about 25 microns, so it's extremely accurate. So instead of having to take impressions with all the goop that you're used to, we are able to scan the teeth and create a virtual model of the teeth. You can see how quick and easy this is. And then you can see we have our 3D model of the teeth right here. We were able to go in and see where the camera wasn't able to see in the shadowing, and we can see all the little details, and we go back and we fill in the blanks, and then we scan the teeth across from it. And that's it. Now we've created a virtual model of the upper and lower jaw. We're going to ask the computer to stitch those together to create a 3D model of the teeth by telling it how the teeth bite together. So now we're going to ask the computer to go ahead and start processing those images into a three-dimensional model. So now what we're going to do is we're going to help the computer to realize how these all the pieces fit together. And so we're going to take that and stitch it together right here. And then we're going to take this, we're going to rotate it in 3D. And then we'll take this and we'll stitch it right over the top. And then this allows the computer to calculate where your teeth bite and how hard they bite. So you'll see the brighter colors mean a harder bite, and the darker colors mean a little bit less pressure with the teeth, so that I'm able to design a crown that fits your bite perfectly with very little adjustment. So then we're going to go to the next phase, which is telling the computer how that tooth fits into your specific arch. So it's very customized for you as the patient, and where that fits within the arch of somebody's mouth. And we're going to line it all up here on the proper axis and proper angulation, and then we'll move forward to the next step, which is where we get to mark exactly where we want the computer to look optically for the edge of the tooth. So we're going to mark the margin. Now what this does is it allows the computer to create a proposal for us, which is really nice. It's going to take your half of this tooth and your half of this tooth and compare those to a library of millions of teeth that it has, the anatomy of the teeth, and then it's going to design a crown that fits widthwise and height-wise with all the little bumps and grooves that a tooth should have, so that we can give you a perfect crown that fits extraordinarily well all in about 2 hours from start to finish, instead of having to wait 2 to 3 weeks. So you can see there's the computer's proposal for the tooth, and it's proposed that you bite on the tooth at those points with that much strength. And now I have the opportunity to go in and decide if there's anything I do or don't like about the crown. I can change it. So for example, if I'm worried that the crown is too narrow right there and that you're going to get food stuck, then I can widen the crown as much or as little as I want to prevent you from having a food trap right there. Just like so. And then once we have the crown the way that we want it, and we have all kinds of interesting tools we can use and analyze and slice, and we can take the other teeth away and just examine the crown and how it looks like it's going to fit. And then we can move forward and we tell the computer to send it over to our milling machine, and that'll be our next step. One of the problems that we had in the past as dentists with very aesthetic crowns or white colored crowns is that the way they were made is we would take the impressions, send them off to the laboratory would create a model of the teeth out of stone and then paint the porcelain on with a powder liquid mixture. They would paint it onto the model of the tooth layer by layer. So for example, they would paint the porcelain on layer by layer, and then they would bake it, and then they would paint some more, and then they would bake it. And what that did is it created porosities, little tiny bubbles and little tiny holes inside the porcelain that at some point, if you were eating something hard or crunchy, it was possible to shatter the crown or chip or break the crown. And some of you may have had an experience with that. What is so wonderful about Cerec is that the blocks of porcelain are created from a solid block created under pressure. So it's extraordinarily hard. I could take this out and put it under the tire of my car and run it over, and I would doubt that it would break or chip. It's very, very, very dense and very, very, very strong. In fact, it's so dense and so strong that in order to cut it and trim it into the crown that we want to put in your mouth, we have to use very hard diamond-coated drills. And so what we're going to demonstrate is how that process happens. We've designed the crown on the computer screen, and we've communicated to the computer-aided milling unit. And now we're going to hit the Start Milling button, close our safety screen, hit the Start Milling button, and it's going to communicate the exact dimensions of the crown on to the computer-aided milling machine. What's wonderful is that each time that this process goes through, the mill will calibrate itself. And so it's going to tell me, please make sure that you have the right materials in there and the right size. I'm going to confirm that I do and hit start. And then it'll give us an approximate milling time, and it'll measure and calibrate. So here it's going through its measuring and calibration process to make sure that everything is in the right place and the right size. And then it's telling us that to make that extremely strong crown, it's going to take 14 minutes and 22 seconds compared to 3 weeks. That's pretty impressive, I believe. And we'll get to watch it start. As the water spray to keep it from overheating starts, it'll interrupt our view here, but we'll get to see the beginning. The average human being can tell the difference of something in their mouth of a half of a human hair. So we have to make sure that everything that we put in your mouth fits very, very, very well so it doesn't bother you and feel off. So there's our lubricant spray. It's going to bring the crown into proximity and it's going to begin. Each swipe of those burrs takes off just a few microns of material, and in another 12 and a half minutes we'll be able to show you. So for the movie magic's sake, we skipped through the whole process of waiting for the 12 minutes for the mill and the polishing so that you can see exactly what the end product is, the end result of one that I did earlier. It's beautiful. It's as good as any crown that I've ever gotten back from a laboratory. It fits very well, slips on at the first try, and I've had multiple patients tell me now that it's the best feeling crown that they've ever had. We've done probably close to 100 crowns now with this new technology, and we're really enjoying it, and all of our patients are really enjoying it as well. We hope that you come and join us to experience Crown in a day instead of Crown in 3 weeks, and experience a new level of customer service and a new level of treatment at Minden Dental. So this is one of our other technologies that we'd like to highlight, which is called an intraoral camera, or an IOC. And it allows us to take a very tiny camera and go into your mouth and show you what I see, so that you and I can have a good conversation and make sure that you understand. This was a case where a young lady had a very damaged tooth with a very big cavity, deep decay in the tooth, and it was very close to needing a root canal. But we were able to prevent her from having a root canal, and we actually used the Cerec technology you just saw to restore it back to normal. And so this is an actual example of an actual patient who had a severe dental problem that we were able to restore and fix with Cerec.